Hi, I'm Dr. Jacqueline Johnston. I'm an assistant professor in the College of Nursing and Public Health. I've been an assistant professor here for approximately a little over 2 years. I've been at Adelphi for 13 years. I am the former director of health services here at the university. I'm currently involved in a research study here at Adelphi with a few colleagues, and we're looking into providers' knowledge, attitudes, clinical skills in relation to dealing with the LGBTQ population. I got interested in this because of the significant amount of disparities that exist in the way that care is provided to this population, and things that I have seen throughout my clinical experiences, not only in private practice, but here at the university when I worked at the health center. The reason that this became so significant to me was when I was working in the health center, we had an individual come in who was a frequent flyer, which is what we call someone that keeps coming in over and over again. And the staff had alerted me that they really weren't sure why the individual was coming in. They couldn't really put their finger on it. It wasn't for anything specific. And they asked me to see the patient to try to build a relationship and see if I could figure out what was really going on. And after a couple of meetings with the individual, I did sense that there was more to the story and built a trusting relationship with them. And they revealed to me that they were gay and that they were very worried because they were due to go home because they were an international student. If they went home, they were afraid that they would be killed for being gay. And so that one interaction with this individual started me on this journey of looking into all the different things that we could provide for this individual, as well as looking at myself, the attitudes in my office, the environment that I work in, identifying different stereotypes and factors that might have made this individual not be forthcoming when they first came in, and really taking a good inventory and assessment of how we could change things. The research that I'm currently conducting, this first study, is looking at the providers that take care of patients from their point of view. I'm trying to identify what their knowledge is, their clinical skills, and their attitudes towards the LGBTQ population, and identifying where there might be weaknesses and where things might foster improvement. And then the second part of my research will start to involve the patient's perspectives and their attitudes and what they see and what they need. Because it's very important to not just look at a provider's view, but to look at a patient's view of what they think is important. And then based on those two ideas, to go even further to see what we can do to make changes as far as educational, further research, policy changes, anything that we can do that nurses do when we complete our research. This research is extremely important to me, and I think it's extremely important to many people in my field. We as providers need to be able to understand all of our patients and understand the different needs that they have. And looking at this population and the current health disparities that exist, they are so extreme, and we as healthcare providers need to understand these differences. We can't treat everybody as being the same across the board. We need to be able to look at them where they sit and understand their needs. And I think that this research will look at both sides so that we can come together, and that's what our goal is to work with our patients in providing patient-centered care and making sure that they have good access, but equitable access and appropriate access.